Colon cancer in the United States is a big deal. It's 154,000 colon cancers are found each year in this country. 52,000 to 54,000 people die of this disease every year in this country. It is the third most common cancer. We have skin cancer is number 1, lung cancer is number 2, this is number 3. And it's the second most common cause of cancer deaths. Luckily, we have a pretty good handle on skin cancer. With the exception of malignant melanoma, we're pretty much able to treat that. So, how does it happen? Well, it turns out that about 50% of people will have at least one polyp in our lifetime. There's 3 kinds of polyps, basically. The pathologists can break that down into about 30 different kinds of polyps, but that's another story. Hyperplastic polyps, those are probably some of the most common. They're not a risk for forming cancer. They come and go. I wish I could tell the difference when I look at them, but I can't. We have to look at it under the microscope to see what's going on. The adenomatous polyps are the ones we look for. Those are the ones that form cancer in 5 to 15 years after they grow, if they grow big enough and they grow long enough. And inflammatory polyps, those are the ones that are in like diseases such as ulcerative colitis or various kinds of inflammatory bowel diseases, and they too can form cancer, not quite as often as the adenomatous polyps. 98% of colon cancers start out as the small adenomatous polyps. Now, I can't tell you how many people who have polyps are going to form cancer. I have a personal history of polyps. I am not signing up for this study that says, let's just let them grow and see how many turn cancers. That study will never be done, but we think it's at least 30%, if not 40 to 50% of those polyps will eventually form cancer if allowed to grow long enough. So your risk of getting colon cancer increases if there's a family history of polyps or cancer. That about doubles your chances. There's genetic factors. About 5% of colon cancers come from inherited characteristics. This is a group of colon cancers that are very tragic. By the time you're 18, you often have cancer. It's very obvious in a family. And we're trying to figure out how to find those people. If you have a personal history of adenomatous polyps, that's obvious, isn't it? If you have polyps, you better pay attention to that. If your age is over 50, 90% of colon cancers occur over age 50. Do they occur younger? Yes, they do. I already talked about the genetic people, which are less than age 18. My personal experience with my youngest patient was 16 years of age, and sadly, it was much too late to save his life. If you lack exercise and have a low fiber, high fat diet, that's familiar in this country, isn't it? You have diabetes. You smoke, drink heavily, or are obese. That all increases your chances because these are environmental causes. And if you've had radiation therapy to the gut. Okay, if you are concerned about having colon cancer, this is what you watch for. Unaccustomed diarrhea, constipation, more than a few weeks. A narrow pencil-like stool. These are all things we've talked about for years, so we may be familiar. Rectal bleeding, abdominal cramping or gas pain all the time. Not the irritable bowel patient who's okay one day and then sick the next, and okay. This is all the time. This is constant for a number, lasting for a few weeks. Hurts when you have a bowel movement. Weakness or fatigue, and unexplained weight loss. That's trouble. We don't want you to get to that point. My job is to help you prevent it. So, thinking back to the last slide, couple slides ago, lifestyle changes. Good fruits, vegetables, grains, antioxidants. Limit the fats. Don't overdo the alcohol and don't smoke. Stay physically active and maintain a good weight. These all will help reduce your chances of developing polyps and developing colon cancer. Now, this is a little controversial. There's some medicines we think may help. We've discovered this. Aspirin, Motrin, Aleve, Celebrex, all those things. The trouble with these, they also cause bleeding and abdominal pain, and so we're not sure that this is something we really want to tell people to do. But it's very interesting because it suggests there's an inflammatory response that makes the polyps form, and so it's more of a research interest. Main thing is get screened. So how do we screen for polyps? Well, the goal is to find those of you at risk. So the standby was a yearly stool guaiac. That's that little card you get. You're supposed to put the little sample on there, and the doctor puts the drops on and turns blue, and oh my gosh, you've got blood, and now we know there's a problem. The problem with stool guaiacs are, if the polyp is already bleeding, the chance of it being cancerous is probably 70–80%. Now, it's nice to know this, but we want to try to figure out how could we find you first before it gets that far. Well, it's kind of neat. The stool DNA testing, it may help, but it's not readily available yet. Insurance companies don't pay for it. It's very expensive. This is what we hope will help us identify people that are at risk for forming the polyps, and certainly hopefully at risk for the familial polyp syndromes, those genetic inherited things that where kids get them very young. This would be very nice. You only need it one time, because you know, if you have the gene, you have the gene. So we'll see how that works out over the next number of years, in the next 5 to 10 years.